My name is Mark Fulchinsky. I'm a postdoctoral research fellow working at the Fargo Institute's Nutrition Initiative.
And my name is Elena Verdu. I'm professor in the Department of Medicine, and I'm also the director of the Farncombe Family Digestive Diseases Health Institute.
I started in celiac disease because I had a passion for nutritional science and digestive health. It was always interesting to me how bacteria are involved in our health and we have to feed them too. So when you have celiac disease and you're on a gluten-free diet, the foods you eat kind of restrict what you're feeding the bacteria. And I wanted to investigate how that was affecting our health from the inside out.
What drew me to the area was the fact that this is a condition with many unknowns, many unanswered questions, and with many clinical gaps. And so when I began as a young investigator, as a principal investigator, I decided to start a career in celiac disease research. And unfortunately, there wasn't much basic research at that time in Canada.
I just published the findings from my PhD thesis where I investigated the role of small intestinal bacteria in fry metabolism. When comparing people who are eating a gluten-free diet or had celiac disease to people who don't have any dietary restrictions, I found that the bacteria that were able to digest fibers were less present in celiac disease. This means that even though we might advise people to eat more fiber because it can help with constipation, systemic health, and the immune system, you might not have the right bacteria to benefit.
Our program has basically had the premise, why is it that individuals with celiac disease develop the condition when there are so many others that have genes, are consuming gluten, and they don't? And so this has been the basis for our long-term research program, where we are investigating how the microbes that inhabit in our gut can modify not only the substrates fiber that the Mark has mentioned, but precisely gluten, the main driver in celiac disease. And what we have found is that bacteria that are harbored in the intestines and even in the mouth, so patients with celiac disease have a deficiency in how they break down gluten. So for us, that is really groundbreaking because it opens the door for perhaps treatments to help sustain the gluten-free diet.
Celiac disease research is at a really good point right now because we have so many breakthroughs going through. Not only from the microbial metabolism, but to the diagnosis and even new therapies that are in development. Right now we have so many breakthroughs that we continue to invest on and develop, and things that we can bring not only to patients to reduce their burden, but also to the researchers to help us accelerate our findings further. Most exciting is a clinical trial to investigate a new diagnostic pathway for celiac disease, which can eliminate their need for a gluten challenge, which takes weeks and is really a significant burden to the patient and to the system that investigates that.
The issue of funding is not a minor one. We usually, scientists, we have to ask for grants, and these grants are at a national level. They are priorities, and celiac disease does not always come into those priorities. Those grants are necessarily conservative, they are project-based, and so they don't fund the long-term years of research that are needed to take a basic discovery into clinical application, like what Mark just mentioned of the new diagnostics for celiac disease. So what would I say to someone listening today and living with celiac disease or with someone with celiac disease? That investment in celiac disease is very important because not only we are at a level of higher discovery, but we need this support to sustain the talent, to sustain people in the area of celiac disease, that we don't lose them to areas with higher funding, to sustain the infrastructure, to create that translational from basic discovery to clinical application. And, you know, in a way, it's a way of saying that the gluten-free diet is not the end of the story. It's just the beginning. And so we need the funding to improve diagnosis and to improve treatment and to support the gluten-free diet.